Many adults, and mostly women between the ages of 40 and 60 years of age, develop shoulder pain and stiffness called adhesive capsulitis or stiff shoulder. The shoulder is made up of three bones: the shoulder blade or scapula, the upper arm bone or humerus, and the collarbone or clavicle. The joint capsule is a watertight sac that encloses the joint and the fluids that bathe and lubricate it. The walls of the joint capsule are made up of soft connective tissues or ligaments that attach bones to bones. The joint capsule has a considerable amount of slack, loose tissue, so the shoulder is unrestricted as it moves through its large range of motion. As the name suggests, adhesive capsulitis affects the fibrous ligaments that surround the shoulder, forming the capsule. The symptoms of adhesive capsulitis are primarily shoulder pain and stiffness, resulting in a very reduced range of shoulder motion. The tightness in the shoulder can make it difficult to do regular activities like getting dressed, combing your hair, or reaching across a table. The diagnosis of adhesive capsulitis is usually made on the basis of your medical history and physical examination. One key finding is how the shoulder moves. The motion is the same whether the patient or the doctor tries to move the arm. Simple x-rays are usually not helpful. An arthrogram, which involves injecting dye into the shoulder joint, may show that the shoulder capsule is scarred and tightened. Probably the most common test used is magnetic resonance imaging, or MRI, to demonstrate a contracted capsule. The cause or causes of adhesive capsulitis remain largely a mystery. Some of the risk factors for adhesive capsulitis include diabetes, thyroid dysfunction, and autoimmune diseases. Anyone who has had a heart attack, stroke, or been treated for breast cancer is also at increased risk for this condition. But a significant number of people develop adhesive capsulitis without any known trauma, medical history, or other risk factors. Doctors theorize that the underlying condition may cause chronic inflammation and pain that limits use of the shoulder, thereby creating adhesive capsulitis. With adhesive capsulitis, treatment of any associated risk factors or underlying medical conditions may be needed before working to correct the tissues around the shoulder. Non-steroidal anti-inflammatory drugs, non-narcotic analgesics, and moist heat are indicated and are to be followed by a gentle stretching program. An injection of corticosteroid into the shoulder joint may be helpful, but multiple injections should be avoided. A physical therapist should assist in the ongoing treatment. The patient should expect a recovery period of 1 to 2 years. Non-surgical treatment is successful most of the time, but when not, a capsular release performed arthroscopically is indicated.